Welcome to the webinar on Kidney Fair, which is coming up May 5th. My name is Anjay Rastogi, and my colleagues over here, Dr. Nilofer Nobakht and Ms. Tammy Winchell, will be walking you through this wonderful event. And we're expecting a beautiful day, so get ready with your sunscreen, with your picnic bags and beachwear and everything else. So with that, let's look at our screen over here. So this is the Kidney Health Fair. This is the fourth one that we're putting together. The first one was way back in 2015. It's on May 5th, and it starts at 11 a.m. and ends at 3 p.m. I'll be going over some of the things that we'll be doing between that time. It's at the Dorothy Green Park. It's the same place that we've had the previous three events, but now this park is called Dorothy Green. And as you guys probably know by now, green stands for kidney disease. So that's a perfect name for this park. And if you want to look at the address, it's at Bernard Way and Ocean Park Avenue. So that's where the location is. Now, if you have any questions, please do ask them, and we'll try to answer as much as we can. And if not, we'll definitely be at the fair, and you can ask the questions directly over there as well. Now, as far as registration, the registration is open. There are two ways to register. One is actually pre-registration online, and we have the link over here. This is if you go to this link, you can register, and we do strongly encourage that. There will be also a small gift for people who pre-register. But if you can't, or there's some problems, you can always call us. Our contact information is over here. This is our phone number. Call us directly or email us, and somebody from my office can actually walk you through it. Now, in case you don't register prior to the event, there's also going to be on-site registration as well. So we just want you to be there. It's a free event. It's a public event. And a question that we were asked, is it only for UCLA staff? And the answer is no. It's actually for everybody, whoever. And it's not just for people with kidney disease. It's actually, a lot of focus is going to be on healthy living. So please do come by. We do put a lot of effort into this. Now, this is the broad layout, and you'll get a much more detailed layout when you come to the fair. But just to orient you, this is where the ocean is. This is the boardwalk. This is the entrance where you'll be registering. And when you register, you'll get a green wristband that will work as an identifier that you actually have registered, and that's very important for liability purposes. Now, once you get into the main area, the stage is over here, and some of the key booths is the transplant, the kidney doctors. There'll be about 10 to 15 board-certified UCLA nephrologists who will be there to answer your questions. So you can bring your labs, you can bring your history. Obviously, we can't go into too much detail, but we can guide you what would be the right approach, and obviously we'll be very happy to follow up. The other big focus is going to be diet and nutrition. We'll have about 10 registered renal dietitians. So if you have any questions about diet, this will be the place to, whether it's about protein, whether it's salt, water intake, this will be the best place to ask them. And our other big focus is home dialysis. So we'll be going over this in a bit more detail. So this is where the home dialysis experts will be. So if you have any questions, if you're on dialysis, getting close to dialysis, or if you have any loved one who's getting there, please come and ask, and we'll be going over the need for this. And finally, one of our big focuses is polycystic kidney disease. So we'll have a booth on PKD. We'll also have a lot of information on trials and studies that are going on. Now, with that, I do want to mention there is a lot of features in this fair, and one of the features is about kids. So our big focus is on kids, and these are kids not just with kidney disease, but are normal kids. And the whole idea is that when parents come with their kids, they can drop them off in this place called the Kidney Zone. So the Kidney Zone is for kids, and we have a lot of fun stuff over there. And as you can see the picture over here, this is Nikki, and that's me. So she was having a lot of fun time. She has a cookie in her hand, and she was having a great time at the previous fair. So with that, Dr. Nobakht, I know Nikki has been working with Michelle Steele, one of our other living kidney donors, on this Kidney Zone. So do you want to talk more about this?
My name is Nilu Nobakht. I'm one of the nephrologists at UCLA, and I've been part of the core program and a colleague of Dr. Rastogi for the past 10 years. Nikki is my 6-year-old daughter that has been growing up in this kidney environment, and she will be at the Kids Zone. We are offering Kids Zone because we are thinking on a Sunday, a beautiful weekend day when you are going to enjoy the beach and attend the fair. You can have your little one with you for hours enjoying the activities that we are offering, like a beautiful big fire truck will be there, braid bar, face painting, and
even for the older children too, the youth, we are having the Boy Scouts come, and they're going to be doing their pioneering ropes and pioneering
That's
poles.
wonderful.
So all age groups are going to have something really fun to do at the
it
fair.
will be a lovely Sunday.
It will be, and these children that are coming from families that are going through chronic kidney disease, it's good for them to be in the environment. They can connect with other kids, and we're going to
Sure.
have youth there that have already gone through the process, whether it's
Right.
transplant families, et cetera, and they can talk and connect with and answer questions for the youth that are maybe feeling a little uneasy about what their families are going through.
Exactly.
Right. And so that's great. And so one, this is a secure area. So
Yeah.
so you can drop off your kids. There's going to be Michelle. There's going to be a whole bunch of people, nurses, physicians,
Yeah.
security guards. So this is some place that you can feel very,
Very
secure,
child friendly.
Right.
very child friendly, and they'll be safe. The key
Yes,
thing is
sure.
that you don't have to. So the parents can drop off their kids over there. It's almost like a daycare. Enjoy
fun,
and
yeah.
and the whole idea about the fair is it should be so and we'll talk about why the fair, why do we call it a fair, and the whole idea is about being positive, and enjoying but also learning, being preventive, you know.
Yeah.
So and we'll be going into in a bit more detail, but the kidney zone is something that Michelle Steele has spent a lot of time, Brandy as well, and we'll talk about the circle of core. We have the fire truck, we have the Build-A-Bears. Yep.
Yeah, we have Build-A-Bear Radio even coming,
Uh,
and they're going to be having some great fun music, and they're bringing Build-A-Bears to give
To
away.
give out, yep,
Yes.
yep.
Uh-huh.
And they will, like you said, braiding and face painting. So
Yes.
so it's and kids, and they're all age groups too, right? So this is a very popular part of the entire fair. So and we call it Kidney Zone. So this will be very
Very
good.
popular.
So that's one. So now let's dive into why we actually have this fair. And the three big focuses of the fair is going to be, one is going to be on transplantation. So this is both for recipients. So we will have the UCLA transplant team over there. And if you're interested in transplant, this is going to be the perfect place to visit, have your questions answered, not just by the coordinators, but also by transplant expert surgeons as well as transplant nephrologists. The other big focus is going to be on living donors. So we'll have a lot of living donors there. And if you want to ask a question, and the proof is in the pudding. When you see living donors, you will see how well they're doing and how satisfied they are with their decision in the past. So that is going to be focused on transplantation. Home dialysis will be focusing on. If you're on dialysis, you should ask the question, why am I not on home dialysis? That's very important. And the home dialysis team. And then we obviously have the diet and nutrition.
Right.
So Dr. Novak, let's talk about the core kidney program. UCLA has this leading core program.
Yes.
What does it mean to you, and what does it stand for?
CORE stands for Clinical Excellence, Outreach, Research, and Education. The bottom line message that we are bringing to our people is saving kidney, saving life. In a very short, brief term, because we know there are like organs or in our life, like if we lose like an arm or a leg, life is not easy, but we go on. Without a kidney, we know that we cannot go on. We need dialysis machine or a kidney transplant. CORE program is bringing basically this message to our healthcare providers and our people in society, that how we can pass this message of achieving the mission. And the mission is how we can save life with saving kidney.
Right, yeah. prevention
Right.
and the education of their
Education.
risks,
Mhm.
risk factors. They can be more aware.
Right.
Yeah.
And I think that's a very good point.
Passing the word
It's
on.
because, so the entire spectrum from even before the diagnosis, so the key things you want is prevention. So
Mhm.
there are patients at risk. And who are the
Yeah.
patients at risk? Diabetic patients. Diabetes is the number one cause. Hypertensive
Right.
patients, medications, older patients, family history. These are all risk factors for kidney disease. So if you're at risk, the key thing would be prevention of kidney disease, and you'll learn a lot how to prevent, how to monitor your labs. But if you have kidney disease, the focus is going to be in a spectrum. Early stages is to cure or slow down the progression. But as it progresses, then you look at the options. And the key thing is always options. The reason why we had the fair is about hope. It's about giving hope, and there's always hope, but a lot of times patients don't know their options. And Tammy, I'll be coming back to you because you have a very interesting story as well, personal story. But going back to about the fair is come over here, learn, depending, no matter what stage of kidney disease you are, or if you don't have kidney disease, but also bring your labs. So Dr. Novak is going to have a booth on the kidney doctors. Once again, like I mentioned, there will be a whole bunch of UCLA board-certified nephrologists at the fair, and we will do the best we can to guide you in the right direction. We obviously can't provide you cure over there, and this is all for information only. This is, you need to talk to your healthcare provider who has more, or she has more access to your records, but we definitely will be able to guide you. So I think this will be a big focus is on education, and the other thing is what we really focus on is if the patient is well educated, they are actually a part of the team. They are part of the care team, and they can make the right decisions. So they become their own best advocates. What questions you should ask, and we have a whole bunch of webinars on UCLA Health, and they're also on YouTube. You can Google them, and we do it almost every month. So a lot of good things to look forward to.
With lifestyle modification that we discussed earlier, how
Yes.
much they can really help to slow down the progression of
Right, that's
kidney
key.
disease
It's
with
the
the
team.
right choices
Yeah.
of what they eat,
Yeah.
Right.
how much activity they are,
Right.
how they are.
Yeah, they're part of
monitoring
that
their
team. The
weight and
patient's
et
part of a
cetera.
big part of
Right.
the team there, right?
Right.
And there's been so much research that's showing that patients who are active in their care and really do participate as that team and they're educated,
Right.
those have the best outcomes.
Right.
I always mention to Dr. Rastogi, fair to me, my family, my colleagues, my friends means hope and being positive, stay positive, because we are going to basically saying how we can save your life
Right.
with your help.
With your help, exactly, yeah. You
Simple
have to take
choices of
action.
life
Mhm.
modification, and we as healthcare providers out there for you. In FAIR, we have several healthcare providers that you need to make an appointment one by one and see them on different bases and different time or hours that we get all together for you at one event. Surgeons,
Yes.
doctors,
Which is so
dietitians,
unique.
social workers, case managers,
Yeah,
all the
it's incredible.
kidney recipients and donors. It's
All in one place.
fantastic.
It's,
Right.
it's incredible.
Right. And going back to, the team that we have, one of the teams is Team Umeed. And Umeed is a word that's used in India, it's used in Persia as well, and Umeed means hope. So it's all about being positive. The other thing that I do want to mention is the lack of dietitian support to our patients. I mean, it's really challenged to get a registered dietitian to see our patients. And one of the things that we always make sure is that we have our registered renal dietitians at the fair. So there'll be a whole group of highly qualified dietitians. If you have any questions, write them down and go. And as I pointed out in the layout, you'll know exactly
Yeah,
where
the booth
to
is,
go.
they can
And you can
approach.
even online now, you can have some questions for Dr. Mustogi.
Yes,
if you'd like.
please
Yeah,
do. Please
at
do.
any time through
And-
this one.
And for me, for Dr. Novak, for Tammy, if you have any questions, if we can't answer them today, we will definitely be answering them online. And also, you can email us too at Core Kidney.
Or they can write it down and bring it to the
We
fair
can
and
also
approach
bring-
them.
Yeah.
Absolutely, absolutely.
The more
But-
questions for us, the better. That's why you're there.
But please be on time. It starts at 11. Please register, pre-register. The main presentations will start at 12 to 1, and we have a special guest, Mr. Philip Palmer, who is the news anchor for
Yes.
ABC7, but also a big advocate for kidney disease. He himself is a living donor. So he will be there, and he'll be sharing his own experiences.
Yeah,
So,
that's
so this will be a very fun-filled day for. There'll also be yoga. There'll be meditation. I know Tammy's going to be speaking about the spirit walk. But before I get into that, Tammy, you have a personal connection with kidney disease. So
Yes.
do you want to just elaborate more and your journey to
Sure.
today?
Sure. About 5 years ago, my husband had kidney failure. He has a family history of polycystic kidney disease. And we knew he was declining very quickly, as the disease does, but we felt lost. We didn't know what to do. We knew when your kidneys fail, you have dialysis, but that's his whole family died on dialysis while waiting for a kidney because the wait was too long. So he felt that was his fate as well at only 54 years old with 2 young children. But we just really dug in. There was very little information at the time, only 5 years ago. We've come up a really long way just in 5 years by speaking out, and people like Dr. Rastogi and the UCLA Core Kidney team who have really worked very, very hard to start educating people on what their alternative options are. And it's been through them that I've been able to help spread the word on other options, other alternatives. So we did go through a kidney transplant. I ended up being the donor for my husband, and everything has worked out beautifully. Couldn't be better. And our kids went through that experience and are now able to speak to other kids, and they also are involved in raising awareness and helping other families understand the process. It's scary. It's a lot of people
Yeah.
don't understand that process, and it is difficult even if they understand it. It's a tough journey, but we are all here to support you through that journey and been working very, very hard to come together in order to provide that in a very organized way. Yeah.
So Tammy, I know your entire family. I'm fortunate to know your entire family,
Thank you.
actually. And Randy, is my patient, and he was a recipient, a great role model, about how to be proactive,
Yes.
And that's something that we really want. The focus is that the patients work together, and that's where UCLA Health's focus as well. So UCLA Health is expanding. We're into the communities now.
Yes.
It's not an ivory tower. It's not
Right.
like, this is university. We're into the communities,
Yes.
and that's a big focus by our chairman, Dr. Fogelman. It's a big focus by UCLA Health to get. So the partnership with patients is, and their families,
Right.
because a lot of these diseases affect families as
Right.
well. So you mentioned, we spoke about the NICI. We spoke about kids, but let's talk about some other kids. Let's talk about this other man in your life besides your husband. His name is Gavin. So tell me more about Gavin. I know Gavin has been very heavily involved with putting up this fair.
He has. Well,
How old is he, by the way?
He's 14.
14, okay.
Homeschooled, so we have a lot of time to spend together on things like this and take on passion projects. This is one of our passion projects. So we just want to reach out and help those that were in the place that we were 5 years ago. And he just alongside me, we together will work on getting out the word however that takes. So whether it's building a video to put out the statistics on the prevalence, or if it's like social media campaigns or a website, we're there working together. He's been my right-hand man.
I work with him very good, and it's surprising he's only 14. And the first fair that we did, your other
My other daughter, yeah, she's 20
Ashton
now. Ashton, yeah, she was
heavily
involved.
So we're very grateful.
She actually started the whole kidney zone.
Yep, that's true. She was,
Yeah,
she
the
was
first
the first
one,
person who
right.
did the kidney zone.
Right.
So now let's talk about, before we get into something else, it's the circle.
Yes.
Circle of Core.
Yes.
So tell me more about this. So our program is called the Core Program, right? So what is Circle of Core?
So Circle of Core are patients, past patients, who have come together with their arms around the Circle of Core, or I'm sorry, through the UCL Core program.
Yeah.
So we are there to embrace the mission of your team and to support your patients in any way possible. And so it's more of a grassroots. It's actually taking their hands
Right.
or, walking them down that journey, taking their phone calls. I've had calls from patients who the night before they go for their transplant
That's
call me up and
wonderful.
say,
That's
I don't even know what to pack in my suitcase. What do I pack?
That is
There's
wonderful.
Simple
just
things, but-
simple
Simple
things
things,
become
yeah.
very important.
And anxiety and
Yeah.
stuff.
Right.
So we, as a team of living donors or past recipients, those that have been on dialysis, those have really gone through the trenches, whether it's dialysis for long periods of time, or we have a wide range of patients and their families, their spouses who have been asked to donate, and they're like, wondering what do I do? What is this all about? We're here for you. We are here to take your call, your email, your text, whatever you're most comfortable with,
Right.
and just walk you through what we've been through and share the experiences that we had so that your experience is improved. It's
Right.
better, it's easier, and it's less scary,
Right.
and you feel supported.
Right, so Tammy, and now we have another special guest that you'll be introducing.
Yes.
But before, let me just re-emphasize. So one of the key things that's going to be coming out of this fair is the Circle of CORE. So the CORE is our program, but the purpose of Circle of CORE. Now, it's not directly or indirectly affiliated with UCLA. It's a
Right.
community-based program, but the sole purpose to support the vision and mission of the CORE Kidney Program.
Right.
So it's very closely linked. I'm involved with it, Dr. Nobach is involved with it, Dr. Kam, with a whole bunch of
Right.
UCLA nephrologists who are working, and not just the transplant team, they're all working with, these are UCLA
Right.
patients who actually look at the unmet need, and put this together. And the purpose is patient advocacy and the support group. So I always say, I don't have ADPKD, but I know about ADPKD, but when patients want to know, they want to talk to somebody
They do.
like you.
Yeah.
And that phone call, whether it be 3 a.m. or 3 p.m., will make a big difference.
Right.
Because a lot of times anxiety, and some of them is just holding their hands and saying it's going to be okay. So,
Right,
so,
right.
so we have, and I know the audience will be hearing a lot more about this over the coming years. We also have a website. Like I said, once again, it's not a UCLA organization, but they work very closely with us. Actually, I'm part of it. Dr. Nobach is a part of it, and a lot of other UCLA people are part of that. So that is the Circle of CORE, and once again, you'll be hearing a lot more. There's support groups for dialysis, for transplant, for ADPKD, for living donors, for clinical trials, you name it, Fabry's disease. So, and if you don't have a support group for pediatrics, we're going to have a support
Yes.
group. So there's a whole entire spectrum. So this is, I think, is very powerful, and I think this is going to change the way we practice medicine.
Yes.
So yeah.
And may I add to that
Yes.
too, is that we are also raising funds
Yeah.
in order to create a center
Yes.
where we could really organize this all into an all-inclusive pre-diagnosis to transplant
Right.
and after support for the patients and their families.
Right.
Yeah.
So yes, so your support it's tax deductible. I mean, I don't like to talk cost support,
Yeah.
but it is important.
Yeah.
Our vision is to put a kidney center at UCLA that will fulfill the vision and mission of the CORE Kidney Program. So no amount of support is little.
Yeah.
So
And I'll
thank-
have an open door policy.
Yes, open door
It's- yeah.
policy, yeah.
Mhm.
Nobody's going to be left behind.
No.
That's the
Right.
UCLA Health's mission, that's our mission.
Right.
So with that,
Yes.
Tammy, you want to introduce your friend?
I do.
Yes,
Okay. We have one of our just fantastic support members with us today. She is full of energy, and she is just lights up a room. And if you're going through chronic kidney disease, she's the gal you want to pick up the phone and call, right? She's talk about positive. And this is Miss Mary Beth Berry.
Right. Thank you so much, Tammy.
My pleasure.
Thank
Thank
you.
you.
Thank you.
Thank you, thank you, thank you. Now I have to get up in the chair. That'll be the hardest part of it. Well, the first thing I would like to say is, it's an honor to be here because I so wish I knew the year before I was diagnosed with end-stage renal failure that there was a kidney fail, that there was a kidney fair, and that I could have gone down on the beach and talked to some doctors and asked some questions. So I'm here today to really tell you, take advantage of a community event where you have experts and people that you can talk to. I thought I was looking at going in-center on dialysis, and I was originally told if I had 10 years, I would be lucky. And so I had the good fortune of being directed to UCLA from another wonderful friend that's a physician at UCLA, and I learned about PD home dialysis, which I had never heard of in my life. I knew nothing about dialysis to begin with, besides the fact that in-center just really seemed like a death sentence to me. So I went on PD, and I did it at home. And when you go to the fair on Saturday, you're going to meet the biggest cheerleader in the world for PD, who'll be your coach and will help you, and allowed me to go to work every day. But the best part is, I can tell you how my husband figured out how we could travel on PD. So if you want to have hope, you have to talk to him about how to get through the airport when you're on PD. It's really possible. And then I received a true miracle because I was a very difficult match. And in December 2016, I got the call and I received a transplant from a deceased donor, Conrad Rulin, who was 29 years old, who was vibrant, had played college football, went to the NFL, and his wonderful family made the choice that he had made when he went to the DMV. And I received his kidney, along with 72 people received from him some parts of his body. So it's amazing how one person can help so many people. And so when you have physicians like these two that are incredible human beings, of course the first thing you want to do, I wanted to jump out of bed and be a volunteer, like, okay, what are we doing? Because the end result, as Tammy said, is you really don't want somebody else to experience what you experience. If you can help anybody, and I could tell you myself the whole time on PD, the physicians were wonderful, but I wanted to talk to somebody on PD. When I got a transplant, the first person I wanted to talk to is, tell me what you did, is it normal, and when did you go out, and how'd you go to the grocery store, and all those different kinds of questions. So I became part of the core kidney program. But the most wonderful thing that really happened is, you know, in every group, there's an amazing leader, and Tammy took all of us who had an interest in volunteering, all really different people. But what we had in common is everybody in the circle of the core that's around this whole program either donated a kidney, got a transplant, were somehow involved. And each one of us have different strengths and different abilities. And when we put them all together under our fearless leader, Tammy, we all realized really why we were doing it. Every single one of us said, we don't want somebody else to go through what we did. The doctors can give you the most amazing experience. We can give you our first-hand experience. There's nothing like talking to someone. So if you come on Saturday, you're going to see all of us there.
Sunday.
Excuse me, Sunday, let's get it
She's
right.
so
Sunday.
excited.
Yeah, it's on Sunday. And so
Sunday.
you'll see us with our shirts on, with the circle of the core. I mean, the most amazing thing, there's someone on our team who really has learned how you use making videos for getting a kidney. I mean, there's help out there, and there's so much hope. And, you know, it's a community-based event, and it's going to be a lot of fun. We're all going to be there. So I hope you come on Sunday, because you'll see us there, and we're
Yes.
ready to
It's
answer
Cinco de
anything
Mayo.
we can.
Yeah.
Yes, Cinco de Mayo. We'll have everything, and I guarantee you, in the area, there'll be the chips and guacamole. I promise.
That's good.
Very good, very good. So with that, thank you so much.
My pleasure.
And also you were involved in the studies too, clinical trials.
Yes, I was saying, I was
Yeah.
part, that's wonderful, being part of the clinical trials and the different medications that actually came out during my time. I believe I was on the study where was one for the phosphorus that
Right.
I had a major problem with,
Yeah.
that Dr. Rastogi was working on a medication for that. So that was just a great experience also.
And the drug is now approved.
Exactly.
And we have so Mary Beth, so thank you so much for being on the trial, because that's how we advance the
Absolutely.
medicine. So
Absolutely.
there'll be a lot of patients who are on clinical studies. And one of the unmet needs of trials is that when you were having challenges with phosphorus control, we were looking at a better binder.
Absolutely.
And you got into that better binder.
Absolutely. And I know there was, the following year was the PKD drug.
PK drug
Right.
That came
approved, yes.
out,
Yep,
which is
yeah.
a life changer.
Yep,
So
we have a
we
good
have that
center.
drug too now, market as well, and we were also the major site for that. And there are a lot of drugs that have come out of the core kidney program.
Yes.
So the core kidney program is thriving. Now we have the Circle of Core to
Yes.
support us. That was a big
Yes.
unmet need.
Yes.
And I think you summarized it very well, Mary Beth, and Tammy, that that, you know, a lot of time patients want to speak to other patients who have gone through the
Absolutely.
process.
Absolutely.
You know, how can they
Absolutely.
deal with those
Yes.
challenges?
And I think it's representing the circle of the core, we can all say, all the people who we know have already reached out, that know us and be impacted by us, that have given so generously to help us see this future, the future of this center really happen. We really appreciate it. Skipping one Starbucks means a lot to us, believe me.
And Mary Beth,
That's right.
Starbucks, Starbucks, you have been such a big advocate of the fundraising. Tammy mentioned that, but I just want to thank you. And I'm still getting emails from your friends, people who you faces something on Facebook that support the core. I just got an email today that how can we help, and that's great. I mean, and they love you obviously so much. So that's we are very grateful for that. And all, but beyond that, all that you bring, the positive energy, it's all, once again, it was about hope, right?
Yes.
So come to the
Yes.
kidney fair. It's as far as we know, it's a beautiful, beautiful day at the beach. Enjoy the day with your family, with your friends. Bring your dogs, pets, whoever you want to bring. And our contact information is will be on the screen pretty soon. So if you have any questions, or you can just Google us, UCLA Core Kidney, CORE. We're also on Facebook, so follow us on Facebook. You'll have a lot of updates. But with that, I want to thank Tammy, I want to thank Mary Beth, Dr. Novak, and everybody else in UCLA Health for giving us the opportunity to put this fair together. Thank you very much, and I'll see you on Cinco de Mayo Day at the beach.
At
Thank you.
11.